This is Dr. Vera Singleton, and I want to engage you today in a topic that is so near and dear to me because so many of my clients have issues with digestion and they seek me out because they're sick and tired of eating less and less foods and feeling horrible every time they eat, whether it's bloating or gas or you're farting. And now you're down to maybe 10 foods that you have on rotation, and that's it. Here is a way that you can get your digestion back to normal. Now, in my practice, I have an amazing number of clients that have waited for 1 to 2 years before they get help. Now, is this you? I know there's a huge number of my clients who tell me this story and they've been waiting and trying different things to make their stomach feel better and taking teas and potions and soups and all of these things, but you're really just down to your wit's end. And it shouldn't have to be this way. Most people start off feeling bloating or some upset after meals, and then you start to notice that more and more foods are causing you upset. And this goes on for a long period of time. And I'm telling you that this is something that you don't have to put up with. Absolutely not. Because one of the things that I see really commonly is that a lot of these issues are covering multiple areas. So it's not just, your stomach or your lower intestine, it's a combination of issues. And a lot of times people just assume, maybe I'm just allergic to foods. And quite honestly, what I'll say is lots of foods that you cannot eat now, you used to eat. So it's kind of weird and, abnormal to think that all of a sudden you've developed an allergy to something. But what changes over time is the way that your digestion functions. So whether we're talking about upper digestive system symptoms like bloating, upset, feeling pain above your belly button, or even between your chest. And that differs dramatically between the issues within your small intestine and your lower large intestine, right? It's really important that you have a good bacterial balance, because here's the thing, and I absolutely want you to get a piece of paper or write this down or text this to your friend. Your bacteria makes a huge difference. Now, your friend's going to think that you're really crazy, right? But the bacterial balance is directly impacted by stress, by the foods that you eat, by the medication that you take, and by the medications that you don't take. So stress leads to digestive issues. Now that's a writer downer. And maybe as a child you had an IgE allergy, right? You went to the doctor's office, they did the skin prick or the patch testing. You may have had a good 10 or 20 patches on your skin and these little pricks, and you have these big welts that form. That's one way of looking at your gut issues. What about the other ways? What about your digestive flora? So we're going to dig down into that. And I guarantee you this is probably one of the reasons why you haven't been able to get rid of your issues, even if you've changed your diet, cut out certain foods, and still are having these symptoms. So why bother taking action now? Well, I'm pretty sure that you're fed up with it. And maybe you're not getting the support to help your digestion, well, because maybe you think it's not urgent, or maybe your clinician thinks that it's kind of all in your head, or, they can't really find anything on an EGD or a colonoscopy. So when that happens, you kind of get the stamp of, you're good to go. This is a seal of approval and you're fine. But there is something else that can be done. I guarantee you. What I do is a deeper level of functional testing and give you treatments that are way beyond just suppressing the issue. If you have reflux, we commonly know that you take Prilosec or an acid blocker, or some people are chewing Tums like they're Jolly Ranchers, right? Or chewing gum. But for the most part, you have to treat the entire spectrum, upper to lower, end of your digestive tract if you want these symptoms to go away for good. And functional naturopathic medicine works wonderfully for this area in between. For when you don't have anything urgent and dramatic and you're not bleeding out all over the place, but you're also really tired of doing this on your own. Now, I run a number of different health programs, and the one that I'm covering today is the digestion and gut program. So if you're interested, there are many programs for you. I typically will have a conversation with you at your first or your second visit about which program is right for you. But today we're going to focus in on the digestion and gut. My perimenopause program is really popular for my women in the 40s and 50s who are just, mover and shakers, but they're finding that their digestive system, and this is very common in perimenopause actually, starts to really go off track because this time period is a pressure cooker for not just stress, but hormonal changes as well. So the perimenopause program incorporates the hormone component plus when you have digestion issues. And with the Healthy Skin program, I also take into account your gut. Yeah, because what your gut flora says and speaks and its relationship to your skin flora, it makes a huge difference what's going on in both territories. So you want to make sure that both of them are very healthy. And of the many clients that I have in the Healthy Skin program, I would say 80% of them we're usually doing work within the digestive system. And generally, if people have hormonal balances, either with thyroid or adrenal, most often I have to do work within the gut to lessen the impact of the inflammation from either Hashimoto's or Graves' antibodies or like I said before, stress plays a huge role in a digestive tract. So for those folks that have adrenal fatigue and stress, they're most likely having some type of digestive problem. And that's because the nervous system in your gut is so important to nurture. And a lot of people don't recognize that. So about me, I have been practicing for well over 10 years. And I've received numerous awards. I've been all over the radio, podcasts, internationally, within California. And it's because I really make the difference for people. I've gotten tons of 5-star reviews to show for it. The work that I do with Ecopolitan, which is a nonprofit organization, is really geared at helping people with cancer surveillance. And believe it or not, I talk a lot about your gut immunity, your general immunity, because that plays a huge role in your skin health. Like I said, your nervous system, right? And a lot of this is anti-aging. This is how you glow from the inside out. Whether we're talking about your skin or your attitude or your personality, you are starting from the core. And my clients are thrilled with the work that I do because I start at the core and I build out from there to make sure that you understand how to have a healthy body, not just while working with me, but forever and ever and ever. Now, a lot of people don't get leaky gut. They hear lots of news about it and read articles about it, and maybe you have a couple of blogs that you follow or IG people that you follow about leaky gut and how to heal it. Well, here's the thing. Leaky gut is a pretty nasty cycle. And when you only focus on food allergies, that's in the bottom 5 o'clock section of this picture, you miss out on the gut flora because the foods that you eat directly impacts your probiotic, whether it's good probiotic or bad probiotic, right? But there's a lot of play in to the leaky gut syndrome and how that connects with autoimmunity and how that connects with the inflammatory signals that are secreted from your gut lining or the critters that live within your gut lining, your gut environment, and how that communicates with your nervous system. your mood, your hormones, your metabolism of nutrients. And a lot of people wonder why their vitamin D levels are so low, or they can't keep iron in their body, or they have these issues with reflux. This is essentially your immune system pissed the heck off. And it's time to put a stop to leaky gut. How do I do this? I take a really comprehensive approach, right? I get tough cases, people that have seen multiple practitioners, and it's because I test. I don't guess, I don't do muscle testing. So if you're looking for that, I'm not the gal for you. But I do objective testing. It's really important that you start off from a place of knowing about what's happening within your body, not from guesswork. And here we can get down to some core obstacles that are really getting in your way. So it doesn't matter whether it's some abnormal bacteria or even candida or yeast that we find on your test, but it's also your mindset, the way that you think about food, the way that you think about stress in your life and how you handle it makes a huge difference. And this is why my gut program is significantly better than just doing individual visits with whomever practitioner, right? Honestly, there's lots of people that you can see, acupuncturists and functional chiropractors, and you have your gastroenterologists, and right, there's all these people, but are they serving the best interest of you for long term? Do they just want to keep you on their payroll forever and ever and ever? Or are they interested in getting you better and getting you back into your life and really teaching you how to navigate in your body? That's what's so important to me and makes me different than any other clinician that you're going to see or come across. I'm here to support you during the toughest time. So when, like I said, you're absolutely in tears and you're tired of not having the foods that you love in your body again, that really takes a toll emotionally. So I'm here and I can help you with this because this is really a majority of my practice. I do this day in, day out. This is what I really shine at. And this is a testimonial, right, of someone who dealt with, again, years of frustrating IBS symptoms, lots of time spent at multiple practitioners trying to get some kind of help. But, again, because I look at the gut from a comprehensive standpoint, so not just food, but your gut flora, replenishing your gut flora, that's number one. That's my priority for you. And of course, I'm thoughtful. I'm fun to be with. At least that's my opinion about it. So lots of reviews just like this for the digestive program. You can check it out on Google and Yelp. This is a food allergy test that I'll run for people. And you can see here, this is a prime example of a leaky gut, right? Just tons of inflammation, tons of foods that this patient was reactive to. Look at wheat, off the hook. But then there's cow, there's egg, there's peaches and plums. My God, how can you live a life without peaches and plums and green olives? This is not a way that you want to live your life, right? Taking out all of these foods forever and ever and ever and ever, right? If your clinician is inexperienced and has told you that you have to get off these foods for life, you're dealing with the wrong person. They just don't know how to restore the gut back to normal. So that this particular profile does not exist for you long term. Again, my secret to doing this, giving you long-term support, is through eradication. So when you get your testing and diagnostics, we know exactly what we're dealing with. Like in that previous example, you know exactly the types of foods that are causing inflammation. You know exactly what's going on with your gut flora. So you can make clear, educated decisions about what foods to take out. There's no guesswork. There's no elimination and reintroduction. There's none of that, right? Clear and straightforward movement forward. Then I give you targeted nutrition. So it's not just about, again, removing the foods. It's like you have to nourish the body. The fact that your body is in a state of inflammation, there's a pull for specific nutrients. And if your body's not getting those nutrients, it's going to stay in the stagnant point, and or it's going to struggle to find these resources from elsewhere. It's going to pull these resources from elsewhere. That's a writer downer, right? And you don't want to have your storage of your B vitamins taken away from your adrenal system or your nervous system or your stress management system to deal with your basic detoxification. You want to make sure that you have a pool of readily available high quality nutrients in your body at all times, especially in this healing process, right? And again, last but not least, it's pulling together all of the loose ends. Once I'm done with eradication and getting you specific nutrients that's helping decrease the leaky gut presentation, it's all about closing up and tying up the loose ends. This is where most clinicians completely drop the ball. You don't close the loop. This leaves the opportunity for other opportunistic bacteria or yeast to come forward. These guys are not playing around in your digestive system. Their goal is to stay living and to populate you. They don't care if you feel miserable. So I do the work to close that gap, to make sure that your system is having less inflammation, having less impact for these other bad flora to then come in and repopulate, and teaching your immune system within your gut to do better, to respond better, and to be able to listen for when something else is going wrong. It can listen for it, it understands it, it recognizes it, and pow, it attacks. And that keeps you healthy and safe, keeps your immune system healthy and safe and quiet. And that means leaky gut, quiet, right? Leaky gut is no longer a part of your life. But this takes time. Again, here's another review from a client, and she, by the way, is an MD, sought out many, many, many consultations from colleagues and was having chronic nausea and vomiting. She was a joy to work with and was completely disrupted by the very simple protocol that I gave her. And within a short period of time, she was able to get rid of her chronic nausea and vomiting disorder. And it's just because we went through those 4 steps. Now, many, many examples of this, and, my program goal and what I want to achieve for you and what you should be expecting is that you have a digestive system that returns back to normal, right? And it's because we're having conversation with this generation and the next generation and the next generation of your gut lining and your physiology. And that prevents these things from returning. When you have clear and objective goals, clear and objective stool testing, food allergy testing, and other types of functional diagnostics, it's very straightforward. And on top of that, and this is the best part, I have someone to help you with meal planning, because it can get rough with taking out these foods and you don't know how to, cook the way, and you're like, Dr. V, really? No wheat, no dairy, no eggs? You're killing me. But if you have somebody on your team that can help you to meal plan, to create foods that are going to be exciting for you so that you can get through this kind of rough patch of getting your body back to normal, this is a no-brainer, right? And the goal is, of course, to get you to eat the foods that you love again, right? That's my absolute goal for you. I am a foodie. I love an incredible meal with friends, with people that you love. And you should not be accepting limiting foods. Well, I can only eat a slice of cracker and it's a diet cheese and that's it. I'm sorry, right? That doesn't make you feel good or social. And people make you feel a little ostracized, even though they're pleasant about it. You want to feel normal. You want to feel like yourself again. And so that's my goal for you with the digestion program. So if you're interested, here's how to get started. You can always book a free consult with me. Get to know me, get to know if I can help you, right? Again, there's lots of people that you could choose from, but you're not going to find anyone like me that's going to work as hard as I will for you to get your gut back to normal. So give me a call. You have my number here. Book a free consult. You have access to my calendar 24/7. You don't need to pick up the phone and call. You can do that from the comfort of your bed or from the comfort of other places, and book your time. And on that consult that you're going to show up for, come prepared. Come prepared with questions. Come prepared with the ability to really make a strong decision and a powerful decision if you want to move forward with having a life that is trauma-free, drama-free, and eating the foods that you love. All right. And then, of course, if you're ready, then your next step is to book the Ultimate Health Makeover first session. And this is where we get started on understanding your story, where you are, how you want to live your life, what your goals and objectives are. That's absolutely important to me. This is your life. This is your health journey. I am here to help you get to the goals and to the level of health that you want. All right. Thanks again. Again, book a free consult. You can go online and visit drverasingleton.com or click anytime at the bubble above.